Hello, good evening. My name is Dr. Ninadi Adami, and I am the course coordinator for BA Health and Social Care at the University of Bedfordshire. I'm just going to spend a few minutes talking to you about our course, what to expect if you decide to join us, and what sort of careers come out of studying on the health and social care course. So why study this degree, you may ask? Why health and social care? Well, I'm sure you'll agree with me that right now health is a big deal in the current climate that we're in. With the COVID-19 situation, there is a lot of attention on the provision of health services for citizens globally and not just in the UK. So the health and social care course is actually quite lucrative at the moment, and we have seen a rise in inquiries about what our degree can be used for. So it is actually a thriving and electric area of study that opens up a wide range of opportunities in different professions. Because it's not specific to healthcare practice, it actually gives people an opportunity to go into different fields, and I'll address that right at the end. But it's very rewarding, and it draws on not just academic skills but also professional skills and transferable skills that you may have developed. So you may be able to do certain things. Like some of you may be very good in playing certain games, some of you may be very good in debating, some of you may be very good in different things that you may not really recognize as valuable. But the health and social care course actually draws on those skills, and we allow you to bring in the soft skills that you have developed by just living and using them in learning and in carrying out our assessments. So whatever you end up doing, whether it's a professional degree, a professional master's, or you end up doing going into graduate employment, the health and social care course actually starts as a good springboard and as a starting point for you if you are interested in healthcare and the health industry in general. So what would you learn? Now, in our first year, we have some very core skills that we are expected to teach you. So at this stage, we are just getting you to learn certain things, not necessarily to be tested on them, but just to develop an understanding of certain things. So you will be introduced to the sociology of health. You'd be introduced to health and social care, the different elements within health and social care. You will learn about law, society, and controversy. You start the process of career planning, developing your academic skills and your research skills as well. In the second year, you will start to develop what you've learned about research. So you'll have 2 research units that you do in your first and second year, but you will start to learn about global public health. Now that's quite an interesting unit that we're constantly developing to fit in the changes that we have globally. You'll also learn into professional working, because whatever you end up doing, health and social care is in the humanities. So you will be dealing with different professionals, and it's very important for you to understand what you need to know and the legislation, the policies around working together as professionals. We have a few options that you can choose from to start to direct your career path. So we have things like refugees, displacement, and the politics of migration, mental health and society, disability, in childhood. We have comparing welfare, sociology of health and illness, and addictions. Quite a wide range, because again, like I said, health and social care gives you that range of courses within the umbrella of health and social care. By your third year, you develop the knowledge from global public health into health services planning and management. That is an exciting unit where we teach you about not just the practice of health and social care, but the management within health and social care. You'd learn about budgeting, you'd learn about funding, you'd learn about bidding and different things that will help you run a practice, so that when you're graduating, you're not just moving into an uncertain career, but you're actually quite skilled and very knowledgeable in the area of health and health management. You'd also do an independent project of your choice with a topic of your choice, but you will be able to pick options such as safeguarding, disability. Again, can you see there is a link from what you may have done in your second year, so that you're developing the learning that you're doing in the third. There is the option of care of older people, health issues in gender, age and ethnicity, work, welfare and employment, and also human rights and global governance. How do we assess learning? Our assessments are very varied and inclusive. They're actually quite fun. And like I mentioned earlier, they draw on existing skills that you already have. So come with all your skills. We are quite excited to even improve our assessments to make sure that we're not focused on academic style assessments such as essays, but we're doing inclusive things such as podcasts and debates to make sure that assessments are testing your understanding of the core things that you're learning and not just academic skills. So in your first year, we have a portfolio, we have role play assessments, we have essays and reports, because you do have to learn how to write academically. In the second year, again, we have a research portfolio, we have case studies, case conferences, presentations and observations that we would expect you to do. If you have a professional practice year, because that's also possible, people take out a year and go in and work, then you will be having 1 year experience in the industry, but you don't pay any fees in that year. By the third year, we will do things like in-class tests, poster presentations. Your independent project is also quite a substantial part of your final year. Now, what can you do with this degree? Like I mentioned earlier, there are varied opportunities that you can go into for health and social care. You can be a housing officer, you can work in counselling and advocacy support, you can be health protection officer, and a very interesting one is a policy analyst. We have heard quite a lot about the failed policies from the Department of Health dealing with the health crisis that we have at the moment. A health and social care degree can actually equip you with the skills you need to be a policy analyst. So you're not just learning about policy, you end up being one of the people implementing policy as well as developing policy. You can become a mental health practitioner. You can go into social work, but you'd have to do a postgraduate degree for that, or a nursing postgraduate degree as well. You can be a public health practitioner. There's quite a lot of buzz around public health at the moment, and that's something that you can do with the health and social care degree. There are management roles in the NHS that you may be able to do as well. There are civil service jobs within the Department of Health, the Care Quality Commission as well as a range of other roles in community health services. Quite a number of our graduates also go on to open to develop social enterprises where they run their own projects. What do you need to, what qualifications do you need? The health and social care degree is quite open, so I would say just work really hard. Whatever you're able to achieve, we are quite embracing of all qualifications that you may have. If you do have BTEC, if you have, even if you're coming in through Access, whatever route you're coming in through, the health and social care, as long as you can evidence an ability to study on an undergraduate level, we would embrace you and accept you. Some people do the health and social care A levels, and that's also fine, but like I said, it's quite open and we would be willing to consider your application.